Welcome to another episode in English with the Alchemist. Today we are going to have our coffee, very long one, it's almost 2 hours long, with Dr. Frank Shallenberger, fondly known as Dr. Ozone. Dr. Shallenberger has been a practicing physician for nearly 50 years, both in the fields of conventional medicine and alternative homeopathic integrative medicine. He has revolutionized the practice of anti-aging and preventive medicine by developing a patented method to measure mitochondrial function, metabolism, and oxygen utilization. He is also considered the leading expert of medical ozone therapy in the United States, and we will discover that he has studied a little bit in Italy too. During this episode, recorded in 2020, we will discover more about the 8 secrets on his book, Bursting with Energy. We will talk about the energy, mitochondrial energy, longevity, and anti-aging. And sure, we will talk about type 2 diabetes and ozone therapy and much, much more. The coffee is almost ready, so let's go and have a coffee with Dr. Frank Shallenberger. Enjoy.
First of all, thank you for being here as a guest. I'm really pleased to have you here. And this is the second time we meet. The first time I called you almost a couple of years ago, just to talk about your bioenergy testing. We will go over everything today. I hope we will have time to do it. So, Dr. Shallenberger, you are licensed as medical doctor and homeopathic medical doctor. I have a lot of notes here with me. Pioneer in the clinical application of oxidative medicine. So you're also known as Dr. Ozone. And you are the founder and medical director of the Nevada Center of Alternative and Anti-Aging Medicine. It's correct?
That's right.
Okay. So there is plenty of things to say about you, but I'm really curious to go over one of your latest books, which is Bursting with Energy.
Okay.
Just a first question, just to talk a little bit about you and how you moved towards this path of a sort of alternative medicine.
Yes. So it started a long time ago, and I graduated from medical school, and I went into regular medicine. And I was only doing it for a couple of years, and I realized it had just so many limitations. So that's when I started to look for other options, start thinking outside the box, so to speak. And I discovered that there's a whole world of things that they just don't teach in medical school. Yeah. In medical school, you tend to think you know everything. And then you get out of medical school, and if you look around, you realize actually you don't know very much. And so that's how I kind of got set on this quest of learning about other ways. How does the body work? And what can we do from a natural perspective to keep ourselves healthy? I'm mostly interested in preventing disease. That's really my interest. A perfect day at the office for me would be where everybody that comes in is healthy and just wants to stay that way. But also, obviously, we have to treat sick people. So I try to find natural ways to treat sick people.
Great. Yeah, fully in line. And but in your book, you start with your story, and you talk about the difference between chronic and acute disease, and then your experience with Linus Pauling. And can you please explain a little bit for our listeners, the difference between chronic and acute disease, and why you were able to cure with the traditional medicine acute but not chronic?
Yes, that's a really good point. Acute disease is when the disease more or less comes on suddenly. An acute condition is something that comes on suddenly. And it's usually due to, say, an infection, maybe a flu, a cold, a pneumonia, maybe it's an allergy, but it's something that's going to go away. it's not going to stay there. A chronic condition is a condition that doesn't go away. And normally you get chronic conditions, as you get over the age of 40. You start to, things like diabetes, cancer, heart disease. These are chronic conditions. They don't go away on their own. The acute conditions, if you just treat the symptoms and have the patient rest, it'll go away on its own. But the chronic conditions don't go away. And then you have to ask the question, why don't they go away? And the reason is because there's a breakdown in the way the body works. So you got to figure out what's broken down, fix that, and then the chronic condition can go away.
You face also in your book aging process. It's full of information. Your book is a plethora of everything. Is very next to the biohacking movement. So it's a lot of things in common. You also have 8 secrets for energy. We will say afterward. But first of all, coming back to aging. What is the definition, traditional definition of aging, and what do you think we can do for aging?
Well, when most people talk about aging, they talk about getting older. That's not what we talk about in medicine. When we talk about aging, we talk about losing function. Yeah. So that if you are, for example, if you're a 30-year-old man, and 10 years later you're a 40-year-old man, unless you're some kind of athlete, you're not really going to lose any function. You're going to be just as good at 40 as you were at 30. Then you go from 40 to 50, maybe you start to lose a little function. And you go from 50 to 60, you start to lose more function. 60 to 70, even more. And so we're looking at function. And the idea is to get to be really old, 80 or 90 years old, and still function similarly to the way you functioned when you were younger.
Wow, that's great. Among the different theories that there are behind what is the cause of aging, there are different theories, and you have focus on one theory in particular, the energy deficit theory,
right.
and EOMD, which is what I would translate for the listeners. But can you please tell a little bit about why you focus on specific on this?
So you want to know, well, what's the difference between a 40-year-old and a 70? This increase or decrease in functionality that accelerates as we get older. Why? And the answer is, the bottom line is, you don't process oxygen efficiently. So we have a whole system that processes oxygen in our cells. They're called mitochondria, right? Yeah. And so all that oxygen that we breathe in, listeners should understand that oxygen only does one thing. It just provides energy. That's it. So all that oxygen I'm breathing in, I've got to process that into energy. That's what my body uses, my cells use to function. If I don't do that well, the cells don't get the energy they require, and the functionality decreases. And that's the beginning of the aging process. And it just gets worse as you get older, because as you get older, a lot of different things happen. And I talk about that in the book to explain why that is. But the most important thing, in my viewpoint, is to measure how efficiently a person is processing oxygen. So if you're an 80-year-old man and you're processing oxygen as good as a 35-year-old man, well, you're basically fully functional. You're not going to have anything go wrong with you. Similarly, if you're a 35-year-old man and you're processing oxygen like an 80-year-old man, your future looks very bad. So what we want to do is measure. In medicine, it's so important to measure. If you don't measure something, you don't really know what you're doing. It's like driving around without a map. You don't know what you're doing. You don't know if what you're doing is working. You don't know if you're going in the right direction. So we have to measure. So that's what got me all excited, because like about 20 years ago, I developed a system to measure how people were using oxygen. And I learned a lot from doing that over the last 20 years.
Yeah, it's great, and there is still on YouTube a few videos. It's all about energy, and you
Yep.
explain. There's a lecture, I think it's 4 parts, and you go through all the elements that are part of the bioenergy testing method. I think we will go deeper in a while. But so you start with so energy, which is the core, and everything is all around. So obesity is also a consequence of poor energy management, carbo diet, and we will see. And the interesting thing in your book, you go through different elements, from food to supplements to hormone, sleep, and so meditation, stress management, and so on. So I really like also your blue plate special diet. Are you following this kind of diet or nutritional paths? So
Really, what I've learned about diet is you can kind of think about it in two ways. One way is you just want to eat healthy, natural foods. Stay away from the junk food. Stay away from the processed foods. Whole vegetables, whole fruit, whole meat, whatever it is you want to eat, but make sure that it's good quality foods. That's part number one. Part number two is to determine whether your body does well with carbohydrates. Because carbohydrates are potentially the big problem for people. Some of us can tolerate lots of carbohydrates and do really well with carbohydrates. Some of us shouldn't have any carbohydrates at all, almost. And so you have to be able to determine that. So number one, eat really healthy food. But number two, figure out whether you're one of those people that has to limit carbohydrates, or you're one of those people that should actually make sure they eat some carbohydrates on a regular basis.
Yeah, that is really important, because people most of the time, looking over the internet, over the fad diet of the moment, or the trend, they say, okay, I go this way, which is a ketogenic diet, paleo diet. It can maybe be good or maybe not, but because we don't know. As you mentioned, it's important to quantify, to measure things. And the bioenergy test is, I think, related to carb. You have the C factor. Am I right?
Yeah, we have the C factor, which basically is measuring that. With the C factor measures how efficiently you burn fat. That's measuring. I call it a C factor. The C stands for carbohydrate, but I call it a C factor because the fact is, if I get you in, for example, and I test you and you're burning fat really well, and then I give you a piece of bread to eat, and I bring you back in 30 minutes and I test you again, you're not going to burn any fat at all. What I've learned is that eating carbohydrates completely suppresses fat metabolism. Now, in some people, that's okay. That's not a problem. And we can talk a little bit about why that is. Yeah. But in other people, that's a big problem. And so we can use that C factor to determine whether or not you're a person that should eat a lot of carbs or a person that should stay away from carbs, how you're doing overall.
Yeah, the C factor is one of the outputs of the bioenergy testing.
Yeah,
there are many more that we will see in a while. And then you go, so from diet to exercise. You have, I think you talk about circuit training and FBR. So what kind of exercise routine? Are you still in line with those?
Yeah, pretty much. And, things change all the time, and we learn a little bit more about. By the way, I've just rewritten the book. So we got a new edition of this book coming out, I'm going to say in 2 or 3 months. But I just rewrote it, updated it. It's been almost 15 years since I wrote it.
Yeah, perfect. That's cool. This is a good thing. It's not available in Italian yet, so the first version. So you talk about then sleep, sunlight, the importance of sun and water. And so let's go down deeper into the bioenergy testing, and so-called EQ. So what is EQ? And briefly, I know that this is could take an entire hour, but your terms.
We can actually make it kind of simple.
Yeah.
Basically, you and I are breathing. We're breathing in and out. We're taking oxygen in, and if we're processing the oxygen we're going to make carbon dioxide.
Yeah.
So I measure how much oxygen a person is breathing in and how much oxygen they're breathing when they exhale. And the difference is how much oxygen their body consumes. Right?
Yeah.
So that much oxygen in, that much oxygen out. The difference is how much oxygen the body actually processed. So I look at that difference. And if it's a big difference, that means that the body processed a lot of oxygen. And that's what I want to see. So what I do is I measure how much oxygen the person is processing. And then I compare that to other age groups. So let's say you got a 70-year-old man. I'm going to look at his oxygen consumption. And he might be consuming the same amount of oxygen the average 35-year-old man. In which case, that's great. And that's what I call an energy quotient. I compare the amount of oxygen that an older person is consuming to what is typical for a younger person. And I want it to be the same. If the energy quotient is 100, that means that the person is consuming oxygen and processing it along the lines of a healthy young person. And that would be the goal. So that'd be 100. If you get an energy quotient of 100, that means you're equal to a young person. If you get an energy quotient of 140, that means you're even better than a younger person. You're, not the median person, but you're high on the oxygen consumption. Then the other thing we look at is how much carbon dioxide you put out. Because when you burn oxygen efficiently, when you consume it efficiently in the body, you have less carbon dioxide going out. When you can consume it with oxygen inefficiently, you have more carbon dioxide going out. So I look at that ratio between carbon dioxide and oxygen, and that tells me how efficient you're processing oxygen. So I know two things now. Number one, how much oxygen you can process. In other words, how many mitochondria do you actually have? And number two, how well are they working? And based upon those things, if your mitochondria are not working well, or you don't have very many mitochondria, I know you have a problem. And we have to work on that and figure out what we need to do to improve that. Conversely, if I measure and your mitochondria are processing oxygen efficiently and a lot of oxygen, I can say whatever you're doing is great. If you're a vegan and you're doing that, it's great. If you're a ketogenic diet and you're doing that, that's great for you. So you can find out if you don't exercise at all and you do well, then that's fine. So it's a way of being able to determine how each individual person is doing, because we're all so different. You can't have a program that's going to work for everybody. Yeah, so you got to have a way of following and figuring out what each individual person needs. And this is the best way to do that, I think.
Yeah, of course. Because it's pretty clear. I also love the way you explain things, because it's very clear and understandable by the majority of people. So this is something you need to know. And so among the different parameters coming out from the test, so there were C factor, M factor, we will maybe see after a while. And while you also what about anaerobic threshold heart rate?
Yes. So what we do is we put people on a bicycle, and the bicycle makes them work harder and harder. And as they're working harder and harder on the bicycle, they're consuming more and more oxygen, right? And so the oxygen consumption goes up, but at some point it levels off. So that's their maximum ability to consume oxygen. So what we do is we find that point and we look and see what their heart rate is. So let's say that somebody, once they reach that point of maximum oxygen, they can't absorb any more oxygen. Their heart rate is, say, 140. Mm-hmm. So that point is what we call the anaerobic threshold. At that point, if they exercise harder than that point, if they exercise so their heart rate goes above 140, for example, they're now potentially doing some damage to their mitochondria. So we don't want any sustained activity over that point. However, we want short bursts of activity over that point, because those short bursts are going to make that point go higher. and make them more efficiently. So we can use the data on that test to establish the perfect exercise program for somebody, which is pretty much critical for people over the age of 40, certainly 45. Almost everybody needs to be on some sort of aerobic conditioning program in order to maintain these good numbers.
Yeah. So
and this is a way of dialing that program in.
Yeah, instead of using a formula with the age numbers,
which doesn't work,
exactly.
It just doesn't work.
Yeah, exactly.
It's no good.
This is practically a sort of VO2 max. It's a VO2 test with some.
Well, it's not stuff. Technically speaking, it's not actually VO2 max, but you're right. It's very similar to that concept.
And then you another thing to say, this test has to be repeated because this point over time changes. So it's not fixed there and then forever. So the more conditioned you are, the more efficiently you burn oxygen and then mitochondria genesis and so on and so forth. Yeah,
typically speaking, as we get older, the oxygen consumption goes down, steadily down. So if I can get a test on you now and then do a test in a year and a test a year after that and see that it's not going down, that's good. That's what we're looking for.
Yeah. So you follow in your experience, your clients. So you follow clients for months, years,
Yeah.
Right?
Yeah. We, typically every year somebody, every 1 or 2 years, you should have this checked so you can see what it's doing.
Cool. So, and going again to your book for the new version, are the 8 secrets still 8 or will change?
Yeah. The secrets are still the same, but there's just different ways of doing them and different ways of looking at, and more information too.
Cool. Yeah. Just to go over quickly, we have water for detoxification and a lot of other stuff. Deuterium, depleted water. What do you think about this?
I think it's really interesting, but I don't know a little bit about it. I can't really comment much. I haven't experimented with it, but that does bring up one good point. And that is, when you're looking at something like deuterium water or deuterium depleted water, this is a good way to assess that. So let's say I get you in and I do a test on you and you score such and such a number, your energy quotient is such and such a number. Then I have you go out for, say, 3 months and drink deuterium depleted water and bring back and retest you. If your numbers got a lot better, that means that was really good for you. If your numbers didn't get any better, that means it's not really doing much of anything for you.
Yeah, clear.
So it's a good way to monitor new things like what you're just talking about.
How long does it take a test, average?
Typically, say 35, 40 minutes, something like that.
Clear. Okay. Then I will post in the show notes all the details of all the links. I don't know really if in Europe we have facilities or I have no idea at all. No clue.
I would love to have somebody establish a testing center over in Europe because I do have a fair number of Europeans that call me about that, but there's nobody over there doing it right now. Only here in the United States. We have one in Mexico. We've got one in Hong Kong. And I'm not sure where else, but nothing in Europe yet.
Yeah. But you need a special equipment. You need a computer with a software. What kind of stuff you need?
Yeah, you need an analyzer to analyze the oxygen and the carbon dioxide, which is fairly small. It's not big, and then you need a special bicycle that connects to the computer and the analyzer, and then you need just a laptop computer. Okay.
So the second secret is rest. Going through your book is very simple, easy to understand, actionable items. And looking at the secrets are not really huge astronomical space stuff. But it's important because almost everything, all the secrets are forgotten, are taken by everyone. So rest is really important. you have some tips. And going to rest, you talk about melatonin, which is very,
Yeah.
very, very important. It's not just a pill to sleep, but it's hormone. Okay, what are your thoughts about melatonin and supplementation?
Boy, I tell you what, over the last 7 or 8 years, I've learned so much about melatonin. And as you pointed out, it goes way beyond what ordinarily I used to think about, in the sense of, everybody knows that it helps you sleep. But I don't know that people really understand how important it is on the one hand, and also how low it gets as you get older. Starting from about the age of 40, it's incredibly low. By the time you reach the age of 70, it's about 1/50th of what it used to be when you were younger. And it's so critically important to prevent. Are you hearing me okay, by the way?
Yeah, it's a little bit scattered, but I can follow you. It's a little bit...
Okay, because and so melatonin, in my mind, might be the single most important supplement anybody could ever take to combat the aging process.
Wow.
And incidentally, it induces deep sleep. So when you and I go out and we work out and we just work and we do all the things that we do in our life, our body becomes we could use the term damaged. We say it becomes slightly damaged, so it's overworked. We need to now rest so it can recuperate and repair itself. And that rest, melatonin plays a critical role in making sure we get into that deep level of sleep that repairs the body. Otherwise, if you don't, every day, the body's slowly getting more and more damaged. And that's where melatonin can be so helpful. And also just good sleeping habits.
Yeah.
Yeah, as you point out, the 8 secrets, they're not really secrets.
Yeah.
Everybody knows about them. But the thing is, most people, they're looking for a pill or a vitamin or an herb or some magnet or some kind of special thing, which is fine, but they're forgetting the very basics. And you can't, if you don't cover the basics, nothing else is going to happen.
Yeah.
You got to cover the basics. If you could have the healthiest lifestyle in the world, if you're not getting adequate sleep, you're going to have a big problem.
Yeah. All the 8 secrets. If you don't have enough, and if you replace, for example, number 3 is the sunlight. Okay, for people living, for example, I spent almost 3 years in the North Europe. Here, winter is basically darkness.
Yeah.
It's very hard. So I had to replace and to do some hacks, and also improving vitamin D supplementation, omega-3, and some additional lights to simulate, also in terms of for depression stuff. But sunlight is free. It's easy, but again, we are forgetting all these basics because we live in office buildings close, and this also this pandemic is also an issue.
Yeah, definitely.
Yeah. So then you go over the secret 4 is a supplement. And you have a list of various supplements, and I really appreciate the fact that you have under your brand the supplementation. You have super fat, I think, super fat and quick. Yes, and but again, I do appreciate you say, okay, you don't need to buy this. There is a list of ingredients with quantities at the end of the book, so this is great. But and you suggest also when to take, how to take, and why you have to take, like detox for the liver and in the morning and so on and so forth. So this is still valid? All the protocols are still okay?
Yeah, we really haven't changed that. That's a very basic formula. It's a formula that more or less everybody can benefit from. It's not totally complete for everybody. Certain people are going to need things that are not in that formula. But I made the formula such that everything in that formula is something that pretty much everybody can benefit from.
Yeah. It has set, and also the quantities. Remember, the quantities are not just random quantities. It's perfect. I will check it out. I don't know if you are shipping outside the international
Yeah,
level?
you can get it. You can go to Advanced Bionutritionals,
Yeah, I will
and
link this.
they sell it there, and they do ship over around the world.
Perfect. And then with Secret 5 is food, of course, and you have the simple guide for food selection, which is don't buy anything with an ingredient label. Okay, this is just funny, but it's real. And then after you see, okay, read the label, because we need to understand not all fats are created equal, and so on and so forth. And then you talk about fasting. We had among our guests nutritionist in Italy, applying also dry fast for a period of time. So dry fast, no water, no liquids. But
Wow.
there are also others and intermittent fasting is another way of fasting or simulating fasting. So what do you think? What is your approach? And if you do it?
Yes, I have to be careful with fasting because I lose weight too fast. My particular metabolism is very efficient at burning fat, and if I don't eat, I will lose weight. But I typically like to do a 24-hour fast once a week.
Once a week, okay.
Where I have breakfast, a real big breakfast, but no lunch or dinner, and so I don't eat anything. I drink water, but I don't have any calories until the breakfast the following day, and I do that once a week. That's really good for you.
Yeah. We have also people working with Dr. Walter Longo with the fasting mimiking diet. There are different ways of approaching, and
it's a great idea.
Yeah. Of course, starting to do 24-hour fasting from one day to the other is not really nice. I mean, but there are plenty of techniques. So you can do 16/8, then you do 20.
Yeah.
Then you do different ways. Till you do 24 hours fasting, and then once per week, once per month. I mean, then people will realize how beneficial, because in terms of regeneration, it's not only losing fat, it's just is regenerating. It's generating the body, it's killing damaged cells. There's a lot of stuff doing. And then so your diet is a change, or what kind of diet you follow?
Me personally?
Yes.
Yeah. I have, it's relatively low carbohydrates. I like to eat carbohydrates in the morning. That works very well for me. But mostly it's low carbohydrates. And you know what? I don't eat a lot of food. When I do eat, I just eat small amounts of food. Mm-hmm. And I just monitor my weight, and I do a lot of working out, a lot of resistance training, a lot of aerobic training. And I just try and keep that balance. But, you just don't, in this modern world, there's a big tendency for all of us to eat more than we really need. And that turns out to be an unhealthy way to go. So I eat everything. I'll eat fish, I eat meat, I have butter, avocados, whatever. It doesn't matter to me. I just don't eat donuts. I don't eat chips. I'll have some alcohol. I'll drink wine. I'll drink some liquor. But no Cokes, no sodas, no chocolate cakes. Maybe on somebody's birthday, but it's a pretty reasonable type of diet. It's not like real special, just clean.
I'm fully in line with this. I tried a lot, from vegan to keto to paleo, but then after a few years, I realized that eat reasonable. First of all, the quantities. This is a matter of how we live today in this world of eating in front of a PC, working, and we need some relax first. And you talk about in your book about osteoporosis and the 5-10 rule. You remember?
Yeah.
Yes. What is it? Can you please?
Well, okay. So it's funny. I was just thinking of that rule this morning.
Oh yeah.
Well, I was doing my exercise and I was doing my sit-ups, and I started to do the sit-ups, and I thought to myself, I don't want to do this. I just don't feel like doing the darn sit-ups. I do them every day. I don't want to do the sit-ups. And that happens to me a lot. And I imagine it happens to a lot of people. They come up to their exercise time. They know they should do it. but they're sort of resistant to doing it. So I developed for myself, I developed the 5-10 rule, which means that I don't care how much I don't want to exercise. I'm going to make myself do it for at least 5 minutes.
Yeah.
If at the end of the 5 minutes, I feel worse, then I get to stop.
Yeah.
I don't have to do it anymore. Okay, I get to quit. So that allows me to go into it thinking, you know what, if I hate this, I get to stop. But if at the end of 5 minutes, I don't feel any worse, I have to do 5 more minutes. Now, at the end of the 10 minutes, if I don't feel better and glad I did the exercise, then I get to quit. But it's surprising, no matter how resistant I am to doing the exercise, pretty much every time, that'll get me through it, and I'll do it.
Wow.
For me, it's a great little rule.
Oh, it's great for sure. This is I would like them to test how many listeners will apply this rule. Which is there are different variations. I heard about do 1 push-up, and then after one, okay, as we are here, something like that.
So exactly, that's the same idea. The biggest thing is just start it.
Yeah. Okay. So let's talk about breathing. So. Are you aware that we are talking a lot in our show about good breathing techniques? Have you ever heard about Wim Hof method?
Oh yeah, for sure.
Yeah, and in your book you differentiate between 2 types of breathing. Can you please go in detail? So
okay,
yeah.
So one way to breathe is to expand the muscles of your chest. And in that kind of breathing, the chest comes up and swells up and the belly sinks in. That's called chest wall breathing. Then the other kind of breathing is where the chest doesn't actually move and you're opening the lungs by pulling down on the diaphragm. So your belly sticks out. So people can know this and recognize this if they just lay down flat on their back and notice how they're breathing. Because when you're flat on your back, you really can't move your chest much. So you're going to breathe almost entirely from your belly. And you can see how every time you inhale, the belly goes out. Every time you exhale, the belly goes back in. And that's an example of what belly breathing, or technically we call it diaphragmatic breathing. You're breathing from the diaphragm. That fills the lower part of the lungs.
Yeah.
The chest wall breathing is something we mostly do when we're standing up, and that's when we lift the chest up, and that's going to fill the upper part of the lungs. So if you want to get a complete breath, you want to fill both the upper part and the lower part. So you got to have a sense of learning to teach yourself this, because most people don't know how to do this. Who knows how to do it would be like musicians, especially, people that play horns and play singers, because they have to get the lung, completely full of air in order to carry on those long notes. So they know how to do it. But most of us, we mostly just do chest wall breathing. We don't do the belly breathing. And the problem with this is that because we don't fill the bottom of the lungs, it tends to make you nervous if you're doing chest wall breathing.
Yeah, in fact.
And I tell my patients, you can experience this. Just do about 2 or 3 chest wall breathes and see how you feel in terms of how calm you are and how relaxed you are. And then try 3 or 4 breathing with the diaphragm and not moving the chest at all. And I tell my patients, go get a belt, put it around your chest, tighten it up so you can't move your darn chest. And then the only way you can breathe is from your belly. And then just breathe from your belly about 3 or 4 times and see what it does to your nervous system. And you'll see it actually calms it down. And this is especially important for people who have tendencies to panic attacks, tendencies to just nervousness and anxiety, especially things to do with like asthma, hard to breathe. If they learn this belly breathing technique, it'll be really helpful for them. And then for people like you and me who don't really have a problem that way, it's a great way to learn to do it when you're exercising. And when I test people for oxygen consumption, I can put them on a machine and see how they do. And then I'll teach them how to do this diaphragmatic breathing. Bring them back. That's all you do. Just teach them how to do that. Bring them back, and they do better on the test. Because they're just basically getting more oxygen into their body.
Yeah, it's right. I hear you just a little bit. I think the connection is not perfect anyway, but I fully understand. And this is a vicious cycle. So if I'm stress, I tend to do chest wall breathing, which is bad because it's increasing my stress physiologically. So it's a loop. So and
exactly. Exactly. You chest wall breathe. You get anxious. You chest wall breathe more.
Exactly. And you suggest a easy but very effective solution. Is a technique. Is a box breathing. You mentioned is squares, breathing in squares. So how does it work?
Well, it's like this, and this is more for people who are having a panic attack or think it might be starting to have a panic attack. Characteristic for a panic attack is you feel like you can't breathe. Now the reality is there's no problem there. You really can breathe. But the nature of a panic attack is you feel that you can't breathe. And so because you think you can't breathe, you start to accelerate your breathing and you start to breathe more from the chest. So this breathing in squares thing, what it does is it stops that. And so if you learn this, if you have a tendency to anxiety, especially a tendency to panic attacks, you need to learn this technique. So that at the earliest onset, when you start thinking, oh my goodness, I think I'm going into a panic attack, and you can start doing this and it'll stop the panic attack from developing. Yeah. It just, it won't let you, if you do that technique, it won't let you breathe excessively from your chest.
Clear. Is it basically we can do 4 seconds, 4 seconds or 5 seconds. It depends on the situation.
Yeah, you breathe. Yeah, the count is not nearly as important, but it's kind of like that. So you take 4 seconds to breathe in over 4 seconds, then you hold it for 4 seconds. Then you breathe out over 4 seconds. Then you hold it for 4 seconds after you breathe out. Then you breathe in for 4 seconds. And that process, for some reason, tends to really calm people down and get rid of this fear that they have that they're going to stop breathing.
Yeah, it's something also linked to the coherence. I have a few apps about HRV and coherence. So breathing in this way helps to align brain and heart in some way. So it's really interesting and effective in particular. It's free. It's also free. Why not?
We like free stuff.
Yes. But and last but not least, and this is a very, very complex topic, is about bioidentical hormonal replacement. I know that you have been applying this technique, and there are a lot of technicalities and that. So, but briefly, in your experience, why you are doing this, and why the bioidentical and not the other ones? And the main effects you notice on your patients.
Well, okay, so let's start with why bioidentical hormones. What are bioidentical hormones, and why are they better than drugs? And so what? I don't know if people realize this, but a drug company can't get a patent on anything that's naturally occurring in your body. So if it's already in the human body, or even in a plant, or in an animal, really, it doesn't matter. They cannot get a patent on it. And drug companies are all about getting patents. That's how they make their living. That's how they make their profits, by getting patents. But you can't get a patent on a natural substance, which is why, unfortunately, it's a bad rule. But which is why they're not interested in anything natural. So they just want to do something that they can make a profit on. So what happens as you and I get older, it's just a fact of life. It's not, if we're going to become deficient in our hormones, it's just a matter of when. For some of us, it'll be later. For some of us, it'll be sooner. But at some point in our lives, we're going to start becoming deficient in any one of 8 or 9 different hormones.
Yeah.
And so when that happens, you got your choice. You can learn to live with hormone deficiency, or you can say, you know what, I'm not going to live with hormone deficiency. I'm going to take some hormones in my body, typically as a cream on your body. It gets absorbed through the skin, or you could do it by injection, different ways of doing it. But I'm going to take the hormones in. And even though I'm old, I'm going to keep my hormone levels as though they were young, similar to when it was when I was younger. Now, the positive aspect of doing that is that you're going to feel and behave like you did when you were younger. And especially you'll maintain your lean body mass. A lot about this is lean body mass, bones and muscles, skin, hair. Everybody, as you get older, at some point, you start losing your muscles. All you got to do is look in the mirror and you can see that. You're going to lose your hair, you lose your skin starts to go bad, and so forth and so on. So the hormones tend to offset that and give you a better quality of life as you're getting older.
Sorry, but when you think is good to act proactively, age in terms of age, or as a result of some tests, or which one?
Yeah, and that's a great question. And I don't know that I actually cover this in the book. I can't remember. I just rewrote the book. And that's one of the things that I added to the book is some new discoveries. And that has to do with hormone receptors. Mm-hmm. So the way hormones work is they go up to a cell. They're a molecule. They go up to the cell and they interact with a molecule on the surface of the cell, on the outside of the cell. Mm-hmm. And we call that molecule a receptor. Now, each hormone has a specific receptor molecule. So let's just talk about estrogen, for example. Mm-hmm. Men make estrogen too, by the way, but of course it's the major hormone for women. And so the estrogen molecule will go up to the cell and find that receptor molecule and interact with that receptor molecule. Mm-hmm. And that interaction then causes changes inside the cell. Mm-hmm. Okay? So when we go do a blood test or a saliva test or really any kind of test, we're testing for the amount of the hormone present. But there is no way to test for the amount of receptors present. Yeah. And so this makes a problem. And the problem is you could easily have a lot of the hormone, but very few receptors, in which case you're deficient, even though you have a lot of the hormone. Yeah. Simultaneously, you could have just a little bit of the hormone, a very low level of the hormone, but so many receptors that it makes up for that, and you're totally okay. So just looking at hormone levels, no matter how it is, with blood, saliva, urine, doesn't matter, is really only giving you half the picture of what's really going on. So it's handy to look at hormone levels, and we all do that. But I want everybody to know that just because your hormone levels are in the range that we call normal doesn't mean that you have enough of the hormone, because you may be deficient on receptors. You may be a lot. And if you look at the hormone levels, you'll see that that's true. Normal hormone ranges are just huge. They're very wide. So why is it that somebody could be totally normal and have a huge amount of hormone, and the other person totally normal and have a very little amount of the hormone? The answer, the difference in the receptors, which once again, we can't measure. So the only way you can really have an idea of whether somebody needs a hormone is you have to ask them questions. Because when you're deficient on a hormone, whether it's from receptors or from the actual amount of the hormone, either way, you're going to have symptoms and you're going to have some issues going on. And so let's just pick on estrogen. If I have a woman, and so what estrogen will do is it's very important for mood and brain function. Mm-hmm. So if I have a woman and she's very forgetful, or she's moody or depressed, and she didn't used to be that way, I'm thinking she might be estrogen deficient. So I might go get her estrogen blood levels and look at them, and maybe they're normal.
Mm-hmm.
And I might say, you know what? She might not have a lot of receptors in her brain. So let's just give her a little estrogen and see what happens.
Mm-hmm.
So this is called a clinical trial. Doctors do this all the time. So we give the patient some estrogen and we see what happens.
Mm.
If in this case, for example, her mood gets better, or her brain starts functioning better, or all the above, then we can say for sure she's estrogen deficient, even though the levels were normal. And that's called a clinical trial. That's the only really accurate way to assess whether anybody needs a hormone, is to know what the symptoms and the signs are for that particular hormone deficiency. And then if you suspect that that's the case, you give them a clinical trial of the hormone and see if things get better.
Guys, a clinical trial, we used to have a certain amount of people. You test a person, each one is different, of course, and n equal to 1. I have two questions about this. The time frame, testing in this way, first of all, there are some contraindications, some possible bad outcomes testing this way. And the other question is, how long does it take to have the results?
It's a good question. It's a really great question. And so first of all, depending on the hormone is sort of part of that answer, but normally you will see a response within 4 to 8 weeks maximum.
Okay.
And the thing that's important for people to know is that if you give the hormone to somebody for only 4 to 8 weeks, even if they didn't need it, it's not going to hurt them.
Oh, cool.
So for example, let's say, and this happens all the time, what I'm going to tell you about. Let's say I have a man come in and he's complaining of sexual dysfunction. He can't get the erection like he used to get the erection, or his libido is down, or there's some problem there. So the first thing that comes to your mind is, maybe he's got a hormone problem. Now there are about 5 other things that will cause that problem too. So it might not be a hormone, but it's very easy to test for the hormone thing. You just give him some testosterone and wait 4 to 8 weeks, and he comes back to you and says, "Hey, I'm normal again. I'm like I used to be 10, 15 years ago." Bingo, that's the issue. Even though his testosterone level may very well be within normal range. Mm-hmm. Conversely, if he comes back in 4 to 8 weeks and says, "I don't see a difference," and that happens a lot, then it's not testosterone, and then you go looking for other things.
Clear. Okay, it's very, very complex because there are a number of hormones, and it depends on also in your experience. There are female and males, so acting different ways, of course. So I think that this was the last.
One thing also, Manuel, I want to mention while I'm talking about it is that so many people are scared of hormones, right? Yeah, because they've heard that testosterone can cause prostate cancer, or they've heard that estrogen can cause breast cancer, or they're just worried that maybe estrogen might cause ovarian cancer, even though there's no evidence of that. But so people have some worries about it. And also people say, well, it's just not natural. The natural state of affairs is to not take these hormones. And so my answer is, number one, there's been plenty of studies out that now clearly demonstrate to us that as long as you don't take the hormone levels back above what they used to be, you get them down to you get the hormones up to where is normal for that person, there's zero danger. None. Not. It doesn't happen. And this has been proven. If you take it away, you have to just get it right. And the second thing is, you have to use bioidentical hormones. Bioidentical meaning that they're identical to the hormone molecule that's already in your body. What the drug companies have to do in order to sell their hormones, the synthetic hormones, is they got to take the molecule that's natural to your body and change it. And here's the problem. Even minor changes can dramatically affect the way that molecule works. And if people, for example, look at the molecules of testosterone and look at the molecules of estrogen, the effect on our bodies is dramatically different, right? Testosterone does one thing, estrogen does an entirely different thing. But when you look at the molecules, they're almost identical. So any change in those molecules that the drug companies are making is going to have some kind of negative effect. And all the studies that have come out showing that hormones cause such problems, it wasn't hormones. It was these synthetic hormones. It wasn't real bioidentical hormones. It was the synthetic hormones. And once you understand what that change is, even though it's a minor change, once you understand that what that change is, then you understand why they are having problems with them.
Sure, sure. I'm in Europe and in Italy. I never went through the market, of course, but I think that this is also available. You mentioned in form of cream or in injection. So
yeah.
I mean, I assume that there are specific dosage for each.
Yeah. So I guess another issue, and I do discuss this in the book as well, and that is that hormones work together. So I tell my patients, kind of think of a band.
Yeah.
You know, you got your drummer, you got your bass player, you got your guitar player, so forth and so on. They all have to work together. You can't like have no drummer. You can't have no bass player. You got everybody, and they got to be in tune and playing at the same volume, and everything's got to be balanced, right? Yeah. That's same with hormones. So for example, let's say I have a patient who's low on testosterone, and that patient needs testosterone. And let's say he's also low on thyroid hormones. Yeah. If I just give him the testosterone and don't give him the thyroid hormone also, there's an imbalance and things won't work out as well.
Clear. You mentioned also, this is also valid for supplements. So when you don't take calcium supplement without taking magnesium, or because you create this imbalance. So and this is
true. Yeah, good point.
Yeah. Before going to the ozone, maybe we can touch a little bit on that.
Okay.
Let's go back at the bioenergy testing again. I have just an overview of what the testing can tell us in general. What kind of information as an outcome? We mentioned a C factor, we mentioned other factors, but just summarizing the global outcome.
Okay. All right. Good. So number one, the energy quotient is basically going to tell you how well your body is functioning with respect to your age. So if you're a 60-year-old man or woman, that will tell you if you're functioning like a 60-year-old, if you're functioning like a 70-year-old, or if you're functioning like a 30-year-old. It gives you a grade. It grades your overall functionality. So it gives you a score number. And now, if it's a great score, that's really good news for you, because that means that with your particular genetics and your particular lifestyle, they work well together to keep you fully functional, even though you're getting older. But if this energy quotient is low, that's also good information for you, because it tells you something's wrong. Because here's the point. The energy quotient can get low 15 years before you actually get the disease. Mm-hmm. It's a very early indicator that something's wrong. We have seen energy quotients, and this is not uncommon, go wrong, be bad, in people in their 40s who are entirely healthy. I've seen it in people who are 35 years old, entirely healthy. They have no complaints about anything, and yet their energy quotient is low. And I know that if we don't fix it, in 10, 15 years, that person is going to have a problem. So it helps to identify if you have a problem that is not, nobody knows about, so that you can fix it before it actually results in a problem.
Proactively, yeah.
Energy quotient is really important.
Very proactive, yeah. Proactive way.
The other thing that's helpful is the resting metabolic rate.
Yeah.
And yeah, this is a really important point. Probably, well, one of the most important hormone deficiencies we see is thyroid hormone deficiency.
Yeah.
And because thyroid hormone is absolutely critical, it pretty much totally controls mitochondrial function. The other hormones affect mitochondrial function, but thyroid hormone literally controls it. And here's the problem. The thyroid blood tests and the urine tests and all the various tests out there that they teach us in medical school, and to use these tests to determine who needs thyroid and who doesn't need thyroid, all of those tests, they're going to miss 90% of the cases.
Yeah.
They will not identify 90% of the cases. So you could go get your blood test on your thyroid. Your blood test could be totally normal, and you still need thyroid, but you don't get it because your tests are normal. So one of the beauties of this testing procedure is that we test your metabolic rate. That's how much oxygen you're consuming just sitting quietly in a chair. That is totally controlled by thyroid. So if it's normal, that tells you your thyroid is functioning well. If it's low, that tells you you need thyroid, despite the fact that your blood tests or whatever test you're doing say that everything's normal. So that's a huge number. So you got your energy quotient is going to give you a score. Then you can next look at this thyroid and you say, well, do I have a thyroid problem or not? That's critical, because if you have a thyroid problem and you don't fix it, that energy quotient is going to go bad sooner or later. Third thing we look at is the C factor that you mentioned. And that's critical, because that's going to tell me the combination between the C factor and the energy quotient is going to tell me whether or not you're the type of person that needs to avoid carbs, or the type of person that actually should eat carbohydrate. They need carbohydrate, because there's a big difference. A lot of people need to eat carbohydrate. If they don't, for their particular genetics, they won't feel good and they won't function well. Other people are the exact opposite. For their genetics, if they eat carbohydrates, they are going to function poorly and get sick. So how do you find out? How do you know? There is no other way to know than by looking at the C factor number, which is a measurement that we make during the test. It has to do with the relationship between carbon dioxide and oxygen. And the way it works, kind of in a nutshell, is when the body is primarily burning carbohydrates, it makes more carbon dioxide. When the body's predominantly burning fat, it makes less carbohydrates. So we can kind of figure it out that way.
Yeah, clear. So it very important information with only one test. So that should be repeated. Every 2 years, 1 year. It's good to know.
Yeah. So let's say I did the test on you, and you're probably going to do good on it, because I can tell that you take good care of yourself. So you'll probably do really well on the test. In which case, I'll tell you, all right, you're doing well. It confirms that everything's okay, that what you're doing is okay, that we're not somehow missing thyroid function, that you're exercising well, your lifestyle is suited to your particular genetics. So I would tell you, okay, look, come back in 2 years. Let's just check it again. Let's see what the number is. If the number in 2 years, the energy quotient, is the same as it is now, that's a really good sign. That tells me, like, even over time, this man is maintaining his energy production. If it's lower, it might still be good 2 years from now. But if it's lower, then I start to wonder a little bit, maybe he's going downhill a little bit. Maybe I got to keep a better eye on him a little bit.
And in your experience, coming back to thyroid, in your experience, the worst, a couple of worst things you can do to damage your thyroid. What are the?
Okay, all right, that's a really good question, because there's quite a few things that wreck the thyroid. One of them is having birthdays. So the older you get, your thyroid, just like everything else, it doesn't work so well. So that's one of the things. But specifically mercury. Mercury definitely damages the thyroid. It's a heavy metal. Fluoride, and they put fluoride in the water systems in many places. And also they put it in the toothpaste, and maybe even in some vitamins. X-rays, especially X-rays in the neck here where the thyroid is, can damage the thyroid. A certain nutritional deficiency, like iodine deficiency especially, but iodine deficiency, zinc deficiency, selenium deficiency can have a distinct impact on the thyroid. And taking in too much chlorine can knock the iodines off the thyroid hormone, and then it won't work so well. Another one is bromine. So bromine is a natural substance, but they put it in a lot of the foods, especially soft drinks. And that bromine will knock the iodine off the thyroid molecule.
Ah,
and then the thyroid molecule won't work well. So those are things that kind of sort of immediately come to my mind.
Oh,
viruses also, yeah. So you can get a viral infection. Gluten is another one. Gluten can poison the thyroid.
Oh.
There's a whole bunch of them.
Wow. So and how to take more care. So you mentioned iodine. So as with food, correct food, avoid high mercury content. I think you mentioned the process to detox. I think it's chelation or something like that. So to remove heavy metals in the body.
Yeah. So that's, so let's okay. I do the energy quotient, and let's say it's low, but it's only a little bit low. Mm-hmm. Probably that's not a heavy metal problem. Normally with a heavy metal problem or a toxicity problem, it's going to be quite low. So when I see the energy quotient's quite low, then I start to think maybe there's some toxicity going on here. The most important toxicity for energy production is heavy metals, specifically arsenic, lead, and mercury. Now here's the thing. Every single human being that we ever mentioned has arsenic, mercury, and lead in them. You can't get away from it. But for some people, those heavy metals are disastrous for them. For their genetics just can't tolerate even a small amount of heavy metals. For other people, it's not a problem. So one of the ways to determine if the heavy metals in your body are actually really having a bad effect on you is to measure your energy quotient. Mm-hmm. If it's above 100, then the metals are not having a bad effect on you. However, if it's below 100, especially if it's like a lot below, then you got to do some heavy metal testing to see how many heavy metals are going on. And you probably want to take those heavy metals out at that point. And that's what the name of that treatment is called chelation therapy. That's the term we use to describe the various treatments that can be used to pull out heavy metals from the body.
Clear. Well, as an overview of your book, I think we cover almost whole sections. Then we are waiting for the new version to come in a few months. So just if you want just to wrap up with because you are also known, you wrote a book, Type 2 Diabetes. And you wrote a couple of books, at least minimum, on ozone therapy. And people are, as far as I know, especially in Italy, or the people I'm aware of, they don't know anything about ozone. And so if you just have a quick, I know that this is hard, but the advantages of ozone and why you're using and how you're using for what. Just
okay. All right. Good question. By the way, there's a lot of ozone therapists in Italy. Mm-hmm. There's quite a few. And Italy happens to be my mentor, the doctor that taught me all about ozone. They basically call him the godfather of ozone therapy, is Velio Bacci in Siena. So this is, and Velio goes all the way back to the late 80s. He got interested in ozone therapy. And he's now passed on. But so Italy is a hotbed of ozone therapy. Whoa. I guess the first thing I want to tell the listeners is that when we talk about ozone in the medical world, it's got nothing to do with pollution. Ozone is in pollution, but ozone isn't the pollution. Yeah. So this is different. Ozone is pure oxygen. That's all it is. There's nothing, no pollution, no poisons, no nothing in there. It's just oxygen. So it's no more toxic to your body than oxygen is, which, by the way, oxygen can be toxic to your body too, right?
Yeah.
So ozone, what we do is oxygen consists of two oxygen atoms stuck together. The reason is that one oxygen atom does not have enough electrons, so it can't exist in nature. It immediately goes and finds another oxygen atom. They share electrons, and they form this molecule called oxygen. We refer that as O2 because there's two oxygen atoms in there. So what we do is we take the O2, take the medical oxygen in a tank, for example, and we run it through a converter box. And what the converter box will do is convert part of the oxygen in there into 3 oxygen atoms per molecule. So it's O3. Roughly 2 to 3% of the oxygen that goes through this generating box will be ozone. Most of it will be oxygen, but about 2 or 3% gets converted into O3. And O3 is ozone. And now the difference between O3 and O2 is in O2, the electrons are perfectly balanced. But in O3, there's not enough electrons to keep it balanced. It's a very temporary molecule. It can't last very long. So because of that reason, you have to make it right away and use it pretty much immediately. But when you put oxygen into the body, it really doesn't do anything. It just sits there. It's not reactive. But when you put ozone, or you put oxygen in the form of ozone in the body, it instantaneously reacts because it needs that electron. It'll instantaneously grab an electron from someplace. And in the process of doing that, it starts moving electrons. And this is what life is all about. This is what we do. We move electrons around, and that gives us the electricity that keeps us alive. So ozone stimulates that. And the cool thing is that as long as you use it as, within the prescribed recommendations, you don't overdo it or something, it can fix darn near anything in your body. It's pretty crazy. You can fix bad joints, bad knees, bad shoulders, injuries. You can fix bad backs, necks. You can fix pain of any kind. It takes away pain. You can put ozone gas into the intestines to treat intestinal disorders. You could put ozone gas into the stomach to treat stomach disorders. You could put it into your ears to treat ear disorders. Put it in the sinuses to treat sinus disorders. Put it in your teeth to treat infections. Put it in your bloodstream to treat infections, viral infections, bacterial infections, all kinds of things. You could put it in your bloodstream to treat cardiovascular problems, heart problems, and problems with the blood vessels. You can treat autoimmune diseases with it. You can treat cancer with it. And people say, well, what kind of thing is that? Where you could treat 20 different things? Who is that? Nobody does that. And the answer is oxygen can, because oxygen is a unique molecule that there's no other molecule like it. We are so dependent. It's so important to us. And that's why it works on all these things. So if people were to come to my clinic or in the clinic of any doctor that uses ozone, they'll see that doctor use ozone in a very wide variety of cases.
Oh yeah, that's great. That's very cool. And you mentioned this could be used with injecting. I mean, or in the blood. I know that there was a sort of machine circulating blood, enriching the blood with ozone, and doing this periodically. I don't know how many cycles, or rectal insufflation. I mean, there are different ways of doing so. But there are all these benefits. But in your practice, you use different techniques, or
yeah, we use everything. We do everything. Well, we'll put it any place. I didn't mention, but you can put it in a sauna, and it'll treat the skin, and it'll absorb through the skin and treat the immune system. You can also put it in a bladder to get rid of bladder cancer. So there's all kinds of ways that you can use ozone effectively. And I would tell the listeners, if they go to Amazon, they can download my book called The Ozone Miracle.
Yeah.
It's called The Ozone Miracle, and it tells you a lot. It really is a great explanation. I wrote it for lay people, because what lay people can do is they can buy their own ozone equipment. You don't necessarily need to see a doctor for everything. You need to see a doctor for some of these. A lot of these techniques you can use at home with yourself, with your family, and you can treat quite a few things just right there at home. And it would be wonderful if every family had their own ozone generator and a copy of this book, because the book tells you exactly how to use it and explains how it works.
Yeah, I remember your interview with Dave Asprey, and he mentioned that he was treating some infection in the eyes. So he was having this ozone machine. The only thing that dangerous, I mean, is to inhale. So you don't want to.
Yeah, you can't inhale it.
Yes.
That's absolutely true. That's the only place it doesn't work well in is in the lungs.
Yeah. And in particular during this period, we went through the different ways of for antiviral, antibacterial agents. So ozone is one of them. Also ultraviolet UVC light to kill viruses and bacteria. But ozone is used in different environments. So, but in that case, you need to have, I read a couple of studies, you need to have a concentration, a certain humidity, relative humidity, and almost saturation. So it's not an environment safe for human being. I mean, then it has to be reconverted and catalyzed to oxygen in order to, this is for I don't know, hospitals or some particular enclosed spaces.
Yeah. You know, especially people, for example, that already have problems with their lungs, like maybe somebody with asthma or somebody with really bad lungs, they're maybe especially sensitive. So you got to be more particular with those people. With most people like you and me, if we inhaled ozone, the only thing that would happen is we just cough for a lot. We'd cough for about the next hour. Nothing bad would happen to us. But if you have one of those conditions and you inhaled ozone, that could be bad for you.
Clear. With this one, we cover almost everything. So, and I will also link all the show notes and your books, and maybe depending on the feedback I receive from the audience, I will contact you again. I will go deeper into more details, for example, in ozone or anything else. Do you have anything to add from your side?
Oh gosh. Let me just say that I would also recommend everybody to read my book called the Type 2 Diabetes Breakthrough. It covers a lot of what we've been talking about. And the reason I think this is so important is because type 2 diabetes is 100% preventable. And if you catch it early enough, it's 100% curable. You can cure it. Now, if you wait too long, you won't be able to cure it. But it's 100% preventable. So if there's a listener out there that's thinking, you know, my mother had diabetes, my brother has diabetes, or the doctor just told me that he thinks I might be getting diabetes, anybody like that, get this book and follow the instructions in there. They're very simple, many of which you and I have been talking about on this show. And that will absolutely cure the diabetes if it's in early stages, and it will totally prevent them ever from getting diabetes. I think it's really important.
Yes, it really is. Yes, I'm not sure the books are available in Italian, but okay.
No, actually they're available in Spanish. You can get a Spanish version, but not. That's it. English and Spanish.
Okay, cool. We will see if we have enough people for a translation. I don't know.
Yeah, we could do that.
Yeah. Well, with this one, I really thank you so much for your time. This will be a very good one. Okay. I will try to have I don't know, a series of podcasts with this. Anything else? Just let me know. I really thank you and for your time, and let's keep in touch.
Okay, very good, Mario. Good talk with you, buddy. Keep it up. You're doing good stuff. This is important, what you're doing, getting the word out.
Thank you very much. Thank you, Doctor.
So long. Have a good one.
Bye-bye. Have a good one.
Did you like this episode? If so, simply subscribe, thumbs up, and click on the notification bell not to lose any opportunity in the future. And remember, sharing is caring, even for a coffee. Even better. Till next time, see you soon.